The Omicron subvariant is causing an increase in cases in South Africa, but health officials are yet to confirm a fifth wave. In fact, the health minister saying we're not there just yet. Tonight, we've registered 7,523 new COVID-19 infections, which represents a 23.0 positivity rate. Let's unpack the numbers further with Dr. Ozair Mohammed, a public health medicine specialist at the University of KwaZulu-Natal. Doctor, thanks for your time. We appreciate it. So there are still lots of questions about this subvariant. We know that it seems to be more infectious. What would you tell the public tonight about their concerns?
Thank you, Shahan. So we need to understand that the coronavirus has been mutating over a period of time over the different waves. So currently in South Africa, the BA4 and BA5 are the most predominant variant that exists. And what is happening currently is that the virus is spreading rapidly, and it's highly infectious. So there are lots of people that are currently being infected with the virus. We also need to take into consideration that in South Africa we are heading towards the winter months, and this will be compounded with the influenza virus that we will experience, because over the past few years, when people were actually wearing masks and isolating and people working from home, then there was a reduced transmission of the influenza virus as well. So now we're going to sit with a double-barrel epidemic. One is with the coronavirus itself, and the other will be the influenza, the seasonal influenza that we get. And as a result, that we will find that many people will be getting sick, and many people will be getting sick more easily.
Why is that happening now, though? Because we're still wearing masks indoors. And if you spoke to scientists last year or the year before, they said that people actually weren't getting the influenza because we're so protected. What's changed?
Okay, so as you would recall, that in South Africa, we're moving from a situation of where we had a pandemic and an epidemic to an endemic situation where we have to live with this virus. And as a result, you would find that we have reduced the non-pharmaceutical interventions, and we've opened up the economy, we've opened up the market. People are traveling more frequently across time zones and across countries, and as a result, we are interacting more with people. So the more that you interact with people, the more you expose to people that might be harboring the different viruses, the greater the likelihood that you will actually get infected with the virus. So as a result of the opening up of the economy and opening up the market, we are faced with this situation. Prior to this, we were a bit more restricted in our interaction, in our social gathering, in our activities itself.
Yeah. All right. Let's just talk about this subvariant a bit more, because, you say it's more infectious, etc., but it's clearly, looking at the numbers, the hospitalizations and the deaths, is not as deadly as the Delta variant. Have we determined that yet?
Well, I think with all the variants that come across, it's a bit too early to say in terms of what the final morbidity and mortality will be. But looking at the figures that we currently have, you are right and correct to say that although the number of hospitalizations are increasing, that is coming off from a very low base, because in the last few months we had very few patients that were admitted with the coronavirus. Now, so we are seeing an increase in the number of hospitalizations, but we haven't seen a really drastic increase in the morbidity in terms of the mortality of these new variants.
Yeah, and I just want to ask you a bit more your expert advice and thoughts on wearing masks indoors. Professor Shabir Mahdi says that given the fact that South Africans are not using the appropriate masks, it's not really as effective, so there shouldn't really be a need for government to still tell South Africans that we must wear masks indoors. What are your thoughts?
Okay, so in any situation like this, and if we have to look at this virus itself, right? So we have to look at the agent itself, which is the virus that's continuously mutating. We have the environment that is most likely to predispose a person to getting infection is when you're in a crowded environment that's not very well ventilated, and you have host factors. So my own impression on the situation is that each person has to take a risk-mitigated approach. So you have to determine, even though it is enforceable and we need to wear, the mask is not 100% protective against you getting infected, but it will reduce the likelihood of the disease being transmitted to you. So for example, if you're a person that has greater risk factors, so if you're elderly, you have diabetes, or you have an immunosuppressed condition, then the likelihood of you coming into contact with anybody, even in a closed environment, and getting infected is very great. So in a situation like that, your risk factors are greater, so it's more feasible or more plausible for a person in that situation to actually wear a mask. And even though it's not expected to be imposed and different scientists have different opinions, each person needs to look at the situation and make a decision on their own. But it is advisable to actually wear the proper mask in order to reduce your risk to getting infected, especially indoors where the ventilation is very poor.
Yeah. All right. Thank you so much for your expert opinion. Appreciate it. Dr. Uzair Mohammed, a public health medicine specialist at the University of KwaZulu-Natal.